Well, I am excited to talk today with Dr. Flowers about the topic of chronic care management, and it's been a really interesting topic in that CMS or Medicare for many people came out with a series of reimbursement codes in the not too distant past in an attempt to begin to reward physicians for the asynchronous care that's already being provided but is not paid for. Dr. Flowers is at a cardiology practice in Birmingham, Alabama, and really is one of the leaders in terms of implementing the use of a technology, chronic care management, and through the technology CCIQ. In doing so, being able to capture the reimbursement that's made available. And what's particularly exciting is that Medicare has increased or modified very favorably the amount of reimbursement available beginning in 2017. And so I'm excited to talk to you today to learn about how are you using CCIQ in your practice, and what have you learned in the process?
Absolutely. Well, I appreciate the opportunity to share our experience. I'm an invasive cardiologist. I've been in private practice for 4 years now. And the group I work with is Birmingham Heart Clinic in Birmingham, Alabama. We have currently 16 physicians and a handful of APPs that also help us. We work in a total of 5 clinics. We have a primary location and then another hospital that we have a new clinic in, but ultimately the others are satellites. And the way we structure our group is that a couple of us are in the hospital on any given week, and we sort of share the hospital duties.
So cardiology hospitalist
essentially
model.
function as a cardiology hospitalist, exactly. When we were looking at the opportunity to incorporate chronic care management into our practice, one of the things that we realized is we're spending a large amount of time taking care of patients who fit the criteria and who have chronic diseases, and we're spending an exorbitant amount of resources to do what we think is the right thing to do, which is to take care of the patient, to provide good care. And when we realized billing for chronic care management and starting a program would allow us to continue to do that, augment what we were already doing, but also to help offset the expense that we were not being reimbursed for, we felt like it was an opportunity that we should take advantage of.
And if you look at the requirements, my understanding is for patients to be considered a candidate for reimbursement, they have to have 2 chronic conditions, one be Medicare Part B, but also have 2 chronic conditions, which estimates are that I've read is that's a fairly high percentage of your practice population. So it seems to fit perfectly for a cardiology practice to do this.
Absolutely.
So when you decided to go down this road and try and pursue the reimbursement, was that an individual decision on your part, or was it a group decision?
Excellent question. Some of both. As a group, we thought it was an intriguing idea, but the group as a whole was hesitant to really put a lot of upfront resources financially into implementing the program without knowing it was how it would play out.
Sure.
So for that reason, it was a slow initial process. As a practice and an individual provider, I was the primary one managing it, so we decided to kind of start with a smaller population and then implement it. Currently, we're now doing it with all our providers.
So talk a little bit about, because as I talk to groups around the country, I think many are intrigued by this opportunity, and they get it that we're already doing this work, we're not getting paid for it, now we need to figure out the best way. But it's not just a payment process, it's also a care coordination, patient care improvement process. So talk a little bit about that part of it.
Right, I think that was the number one decision for me and for us as a group is we want to make sure that we're providing the best care possible. And not only did this seem to augment what we were trying to do, but it seemed to improve the patient's experience, improve patient engagement, and seemed to be a win-win for us. So that was a big factor in why we did it to begin with. Ways I've seen that occur are, there have been several effects, I think. Number one is patients feel a little more secure and have a greater connection with the practice, because they now have an additional point of contact that they or way of communicating with us that we did not previously have. So there's another person, our chronic care management coordinator is a medical assistant who functions day in, day out, communicating with these patients, following them through the ChronicCareIQ program. And so she communicates with them regularly. Many of them she now knows on a personal level, even more than I as their provider. If I see them once every several months or a year, she's communicating with some of them on a weekly basis. And so I think that's given us a lot more information. It's also provided a lot more communication and comfort level for the patients. I think the other big benefit is that it's encouraged patients to be more proactive in their own care. So the ChronicCareIQ program does this in several ways. One is it provides a reminder every day that the patients need to do the things that we typically are asking and encouraging them to do anyway. Check their daily weights, check their blood pressure, take their medications. And the way it accomplishes this is by putting an app on their phone or on their smart device, be it an iPad or some other type of device. And we set a reminder, we set the protocols. So some patients get a reminder 5 days a week, some patients get a reminder less than that, depending on their particular condition or the protocol.
Very customizable.
It's extremely customizable. And we designed the protocols and worked with the ChronicCareIQ staff to utilize some of the protocols they already had in place. So we can catch trends in patients' clinical condition. In particular, the one that I've experienced this to be most helpful with is heart failure. So I can follow a patient's weights on a daily basis, and as they enter the information into the app, that's uploaded real time into our system. And if it triggers certain parameters that we've set, then it flags us that something has changed with the patient. We can also set up reminders, so we can email the patient's family, for example, if it's someone who has a family member who's primarily involved in their care, then they will get a reminder that, or a flag, an email, saying what the problem was or what the trend is. And it just allows a better coordination of care for those things that we're monitoring. One other thing that's been helpful, I found that a lot of times the patients were already doing a lot of this themselves. So we were encouraging them to do things. They were doing some of the work, but didn't have a way to get this information to us in a timely manner or in a manner that was meaningful or accessible for me as their provider. So it's bridged that gap tremendously.